Hi, my name is Andrea Leonard. I'm the president and founder of the Cancer Exercise Training Institute. Today our focus is going to be on lymphedema. Lymphedema is the swelling of an area of the body or of an extremity following lymph node removal or radiation. Now, lymphedema can happen anytime after surgery. It doesn't matter if it's a day after or 20 years later, that risk will not increase or decrease based on time alone. There are a number of other factors, though, that can increase your risk if you're already at risk. So that means you've had lymph nodes removed or irradiated. If you have a higher percentage of body fat, that can increase your risk because the fatty tissue interferes with the flow of lymphatic fluid and also can retain fluid. Being higher in years, so those of you who are older, that increases your risk of lymphedema. And having an infection will increase your risk. And I'll give you a good example. Let's say every morning there's 1 million cars that go down 3 lanes of traffic on the freeway. And all of a sudden we shut down 2 lanes of traffic, but you still have those same 1 million cars going every morning. What happens? You get a backup. Well, the same thing happens with your lymphatic system. So if you have lymph nodes removed under your armpit, you're used to having all that lymphatic fluid going on a day-to-day basis, and now you've got lymph nodes removed or damaged from the radiation, and the lymphatic fluid can't flow like it normally would. So therefore, it can cause a backup in that area. Now, the good thing is, if it's caught early, it's usually reversible. But if it goes untreated, it is progressive and can go on to more advanced stages, and ultimately it can even result in an infection in the lymphatic system. So the most important thing that I can do is teach you how to prevent lymphedema, secondly, how to identify it, and lastly, how to manage it. There are 3 stages of lymphedema. Stage 1. You might wake up in the morning and the tissue is normal consistency, no swelling. But later on in that day, it gets what's called pitting edema. And that's where you can take your thumb, press it into that particular part of the body, and it actually holds that indentation, if you will. Normally, if you press your thumb against your skin, it blanches, it turns white, and then it refills with blood very quickly. But when it starts to get that pitting stage, it will actually hold that indentation almost like Play-Doh, so for a longer period of time. Now at stage 1, as I mentioned earlier, it's still considered reversible, so it's extremely important that if you notice that you have pitting, that you go to your doctor immediately or a physical therapist and find out for sure if it is lymphedema. Now at stage 2, it's no longer in a pitting stage. At this point, the tissue becomes filled with fluid and it takes on more of a spongy consistency. Unfortunately, at stage 2, this may be chronic, so this is something you may contend with for the rest of your life, but it is manageable. So with proper lymphatic drainage and treatment, the correct exercises, you can keep it down to a minimum. Stage 3 typically happens with long-term untreated lymphedema. More often than not, it is in the lower extremities, and it's referred to as elephantiasis. At this point, it's disfiguring and extremely painful. And as I also mentioned earlier, if it goes untreated, it can in fact lead to an infection in the lymphatic system. Let me start off with a basic description of how the lymphatic system works. Now, it's much more complex than this, but this is just a general understanding. So if you've had lymph nodes removed in the neck, the lymphatic system flows upward in this particular case. Everything else is going to go down with gravity. So it's kind of illogical, but nonetheless, if lymph nodes have been removed or irradiated, you're going to be looking for swelling in the neck area and up into the jawline. And you can do that same pitting test anywhere to look for early signs of lymphedema. Now, if you've had an axillary node dissection or a sentinel node biopsy or radiation on the left arm, you're going to be at risk for lymphedema in the left arm, in the chest area, and potentially in the upper back, in the lat area. And it can happen anywhere on the arm, so you want to monitor all the way down to your fingers and all the way up your arm. But the flow is going to be downward. Same thing applies for the other side. So if you've had lymph nodes removed on the right side or irradiated, you're going to be at risk on that right arm and the right chest and the right lat in the back. It's very unlikely that it would disperse into the middle of the torso. If you've had lymph nodes removed or irradiating in this area of your chest, now we're going straight down the middle. So we're going to look for swelling in the chest area and down the next level, which would be in the abdominal area. So your area for monitoring is going to be right here in the middle section. Now where it gets tricky, if you've had lymph nodes removed or irradiated anywhere in the pelvic area or lower, you're now at risk for lymphedema below the waist and in either leg. And there's no way of knowing which leg the lymphatic flow is going to go, what direction it's going to go. So you're going to look for swelling in the abdomen, in the pelvis, and down both legs all the way down to the feet. And you can't neglect one side. You've got to look at both sides. And the other thing about lymphedema, it's not just the swelling. You'll notice pins and needles feeling. There can be a burning or warm sensation, and that area of the body, particularly if it's a limb, will get very heavy. One of our jobs as cancer exercise specialists is to inform our clients about lymphedema, because unfortunately a lot of people aren't even told about lymphedema. They're so busy, trying to cure the cancer and dealing with some very important concerns with treatment and surgical decisions that sometimes it gets overlooked. So it's really important as a trainer that we let our clients know about lymphedema, how to prevent it, and how to manage it. So we're going to go into some exercises both for upper and lower extremity, and I'm going to show you how to open up the lymphatic system and promote lymph drainage. And this is great for prevention or for anybody who already has lymphedema. Whether you're at risk for upper or lower extremity lymphedema or anywhere in between, the beginning of our exercise protocol is going to be exactly the same. The idea here is that we have to empty out, if you will, the lymphatic fluid from our midsection so that it has a place to drain from our extremities. So we're going to start off with crunches and pelvic tilts. Begin by laying on your back with your legs bent, feet lined up right under your knees. Arms by your side, and in order to do a pelvic tilt, just simply draw the belly button towards the floor, in essence flattening out your back to some degree, but not forcing it against the floor. You want to keep what we call a neutral pelvis, and you'll hold that for a couple seconds and then relax. So drop those hips down and relax. And you can do this 5 times, 10 times, whatever is comfortable for somebody starting. And that's going to depend on your previous fitness level. So somebody who was a conditioned athlete prior to going through everything can easily do 10 of these, where somebody who is deconditioned to begin with, 5 may be sufficient. Next, we're going to go ahead and do crunches, and I'm going to show you 2 options. One is just a regular crunch, and the other one will be with an exercise ball to help people who have bad necks. So to start off, once again, you're going to lay back. Hands go behind your head, supporting it gently, but keeping your chin in neutral. You exhale as you go up and pause. Again, pulling that belly button towards the spine, and inhale back. Exhale up and inhale back. Now you can see where if somebody had neck problems, that puts a lot of strain on the neck. So the ball is a great alternative. Okay, now this is a small exercise ball, which is just perfect. If you're using too large of one, you're going to find this a bit of a challenge. So what you're going to do is lay back, and your arms will go straight up, perpendicular to the floor. Palms are flat. You're going to exhale and bear down, just like you are with a crunch, but instead you're keeping your head on the floor and you're pressing against the ball. You exhale and press. Inhale and relax. My abdominal muscles are all contracting while I'm doing this, even though you can't see any movement. Exhale as I push. Inhale as I relax. And worst case scenario, if somebody can't get down for whatever reason, they can do this sitting up. Same size ball, arms are parallel to the floor now. They're going to exhale and press straight down. and inhale and relax. Exhale down, inhale and relax. And just like with the pelvic tilts, 5, 10, whatever is good. We just want to get things moving, get things flowing. This is a warm-up. Prior to doing these, it's a really good idea to do 5 minutes of cardiovascular exercise, and that will warm the system up even more, getting the joints lubricated, the blood flowing, and then go ahead and do your crunches and your pelvic tilts prior to doing the next series of exercises we're going to do. Another point I want to make is for anybody who has high blood pressure, it is imperative that they do not hold their breath. And a lot of people, when you're holding a count, will actually hold their breath, and they'll do this. That is an absolute no-no, because it actually raises your blood pressure even more. So if you have high blood pressure, either don't hold it as long or make sure that you are absolutely breathing during the course of the exercise. So you've done your 5-minute warm-up, and you've done your crunches and pelvic tilts, and now we're going to start off with upper extremity exercises to open up the lymphatic pathways. But let me also tell you, as you move on and you do this more and more often, you're going to want to increase that warm-up in 2 ways. One, the time or duration, so you can increase from 5 minutes to 10 minutes to 15, up to a half hour if you can tolerate it, but also the intensity. Up the level, go faster, put more tension on it. But at first, it's really important to start and progress slowly, because you don't know what your lymphatic system can handle anymore. It's not the same as it was prior to your surgery and treatment. So you need to go gradually and make sure that at any stage along the way, you don't see any swelling. So if I went from 5 minutes to 20 minutes and all of a sudden my arm swelled up, I don't know that it wouldn't have been fine if I had only done 10 minutes. And the only way you're going to know that is if you go one step at a time. Now, increasing your body temperature can also increase your risk of lymphedema, because you're increasing the circulation and the flow of lymphatic fluid. So there's kind of a contradiction there, because we want you to increase your body temperature to increase your intensity so that you burn fat, which decreases your risk of lymphedema. But on the same hand, if you increase your body temperature, that increases your risk of lymphedema. So where do we land? Well, for starters, stay very hydrated, drink lots of water while you're exercising, and it's best to exercise in a cool or air-conditioned environment. If you live in a place that's very humid in the summer, don't exercise outside. Stay inside in a nice controlled environment. There are a number of things in addition to heat, in addition to age, body fat, and infection that can increase your risk for lymphedema, and you need to make note of these. For starters, be careful of burns, cuts, scrapes. They may seem like nothing, but if bacteria gets in there and you get an infection, what's going to happen? The lymphatic fluid's going to that area. It's like fighter pilots that are on alert, and they're just waiting for the infection to knock it out. And they all go rushing to that area, but they can't get back out. And that's where you get that backup. So you want to make sure that if you get a cut, a scrape, a burn, a bug bite, you immediately clean that area with antibacterial soap. Put some bacitracin on it and cover it with a Band-Aid, and then you're going to look for signs of swelling and redness. And if, of course, you notice that, get to your doctor right away. And I don't mean to instill panic in you, but it's just really important so that you can catch it early if it is lymphedema, and it doesn't have to get to that next stage. Another important thing is to not restrict the flow by wearing constrictive clothing. So if you're at risk for upper extremity lymphedema, don't wear a tight sports bra or tight brassiere. You don't want anything that's going to cut off your circulation up here. If you're at risk for lower extremity lymphedema, be careful of anything with a tight waistband or tight elastic on the thighs, as that can also cut off or restrict the flow of lymph. So make sure your clothes are nice and loose, and it will also help to keep you cool. Don't wear tight fitting jewelry on the side at which you are at risk. So if I'm at risk for lymphedema on my left side, I can wear jewelry and do whatever on my right side, but this particular side, I don't want a tight watch, a tight bracelet, or a tight ring that could potentially restrict the flow of lymphatic fluid. And on that same note, I don't want to get a manicure on this particular side where they could cut or scratch my cuticles for the same reason. If an infection gets in there, those fighter pilots go to work and I increase my risk of lymphedema. So if I'm at risk for lymphedema in my left arm, am I going to get a manicure? I can get polish, I can get them buffed, but nothing that could potentially cut me, but no problem with getting a pedicure because I'm not at risk in my lower body. Now, for anyone who's at risk for lymphedema in their lower body, you have no problems getting your hands manicured, but you are not going to want to get either foot manicured in such a way that would risk cuts, scratches, or anything else that could potentially lead to infection. So having your feet massaged, having your toes polished is fine, but nothing that would cut the cuticles. A lot of you may love to go in a jacuzzi, a sauna, a whirlpool, but that too will increase your body temperature, increasing circulation, increasing your risk of lymphedema. Now, I know very well that if you have a jacuzzi, you're not going to stop using it. But if you do these lymphedema drainage exercises before and after you go in the jacuzzi, at least that will minimize your risk. And in a perfect world, you would avoid anything that's going to heat your body temperature up. Tanning beds, outdoor tanning, a hot bath, a hot shower, anything like that can potentially increase your body temperature. Another thing is sports with repetitive motion. So for example, if I'm at risk for lymphedema in my left arm and I play tennis and I use my left arm and over again I'm using that limb, that's potentially going to increase my risk. And I keep using the word potentially because it doesn't mean you're going to get lymphedema. That potential is just there. So if you're a tennis lover, if you're a golf lover, I don't expect you to quit your sport, but you're going to want to do these exercises after a warm-up and before your game of tennis, and then after your game of tennis to minimize your risk of lymphedema. And if you're at risk for lower extremity lymphedema, things like biking, running, rollerblading, anything with repetitive motion on your lower body is going to increase your risk. So same thing, proper warm up, and you'll do the exercises that I'm going to show you for lower extremity lymph drainage to help prevent that. And on a final note, I want to let you know that a change in altitude can also increase your risk of lymphedema. So it is really important that you consult your doctor or lymph drainage specialist prior to getting on an airplane and get fitted with a sleeve or a stocking, some type of garment that will help minimize your risk of lymphedema when you have that cabin pressure and change of altitude. So just a number of things to think about in terms of preventing lymphedema, and we're going to move on now to the upper extremity exercises. So we've warmed up, we've done our crunches, we've done our pelvic tilts, and I'm going to have you begin with your arms up at shoulder height. For some of you, this might be an effort in and of itself, especially if you have scar tissue or adhesions. So if you can only hold them up for 10 seconds and you can only manage to do one or two of these, that's okay. Begin with one or two. But we're going to start with our arms at 90 degrees, soft knees, and don't arch your back. And you're going to just rotate your hands. Your palms are going up and down. Nice deep breathing. The breathing is really important also. We need to get that oxygen